Hello, everyone. My name is Grace, and I'm the scheduling coordinator for NJ4S Union Hub. Today, we'll be having our presentation. Today's presentation will be PCOS, Endometriosis, Fibroids, PMDD, What Every Woman Should Know by Khadiza Kubra. A little bit about her. Khadiza Kubra was born in Bangladesh. It's a country where many girls are not encouraged to have a professional career. When she moved to the United States, she worked towards breaking the culture barrier of her community and pursue a higher education. Khadiza completed her bachelor's in biological sciences and master of public health and epidemiology, concentration from Rutgers University, New Brunswick. She's a first-generational college graduate hoping to inspire other first-generation students to achieve success in education, career, and personal lives. So without further ado, I'll hand it over to Khadiza for her presentation.
Good afternoon, everyone. My name is Khadiza. Today, I will be talking about PCOS, endometriosis, fibroids, PMDD, and what every woman should know. So before we start, I want to introduce NJ4S, the New Jersey statewide student support system. And we work with addressing youth mental health crisis in our community. And our aim is to support the youths and their families in both academic achievement and well-being of individual students. So today's agenda is we will do the introduction of the topic, and we will talk about the treatments, the causes and symptoms of PCOS, endometriosis, fibroids, PMDD, and we will wrap it up with how we can support and share some resources. With whatever is going on in the world, we see that understanding women's reproductive health is important for overall well-being, right? So by taking care of ourselves and making informed decisions, we can better manage our health. And today, our goal is to provide accurate information and clear up any common misconceptions about PCOS, endometriosis, uterine fibroids, and PMDD, so that knowing it can empower you to make informed choices about your health. So PCOS is also known as Polycystic Ovary Syndrome, and by definition, it's a hormonal problem that affects women of reproductive age. So according to World Health Organization, reproductive age is around 15 to 49. So what PCOS does is it affects the ovaries. Ovaries are the organs that usually stores our eggs. So if you see on the illustration over here, on the left side it has the normal ovaries, on the right side it has the polycystic ovaries. So the difference is the ovaries on the right side has like little cysts on them, and it's filled with filled with fluids. And the prevalence of PCOS is like around 7 to 10% women, which is like around 5 to 6 million women in the US are affected by this. And a lot of the times, many women, they don't even know they have this condition. So some of the signs and symptoms includes irregular periods. So it could be like a heavy, long, or intermittent, unpredictable, or even absent periods. You can have cysts in the ovaries, as I shown here. Which are like small fluid sacs that produce androgen, which is a hormone. You can have acne, weight gain issues, hair loss, or even have like excessive growth of hair in face or body. Insulin resistance is also common, which can lead to type 2 diabetes. Other things like hypertension, which is high blood pressure, could be common as well as other heart diseases. So there is no exact cause to be known for PCOS. Some influencing factors could be genetic factors. So if your mom or your sister or other female relatives have it, you have a good chance of getting it as well. hormonal imbalances. So it could be related to like insulin resistance, like I talked about earlier. So insulin is basically a hormone that produced by like our pancreas, right? It allows our body to use sugar. So if our body is resistant to the insulin, sugar levels in our body goes up, producing more insulin. So like it's like it could lead to like type 2 diabetes and other health issues. And other possible factors, high androgen level. So androgen is also another hormone. So when we have too much insulin, it produces androgen. So too much androgen can also affect female's body, especially with reproductive organs, and cause acne as well. So diagnosis and test, they usually do ultrasounds and blood tests to check your blood, as well as take images of your uterus, just to make sure if you have a cyst or not in your ovaries. And some treatment options or medications, a lot of doctors, they prescribe birth control pills, and metformin is another common one. Just to like metformin it also helps in this condition as well. So some lifestyle changes could be a treatment. So diet, losing your weight, exercise, and some fertility options like IVF. So how does PCOS impact on mental and physical health? So so physical symptoms like weight gain and excess hair growth and like can affect our self-esteem, and like it can also lead to like anxiety, depression, bipolar disorder, OCD, obsessive compulsive disorder, and struggles with fertilities and irregular periods can cause emotional stress and also body image issues. So physical health, PCOS can affect like fertilities, making it harder to get pregnant. Increases the risk of metabolic syndrome, which can lead to higher risk of diabetes, higher risk of heart diseases, and long-term weight management can be a challenge for a lot of people with PCOS. So next we have endometriosis. So the definition is tissues that are similar to the lining of the uterus grows outside of the uterus. So this is our uterus right here on the right side, and usually the cells are growing outside. So if you see on the fallopian tubes, there's some growth on the ovaries on the right side. So usually endometrial tissues, they're inside of the uterus, and it thickens and breaks down as we get our period each cycle. So when tissues like that grows outside of the where it's supposed to be, it affects our ovaries and fallopian tubes and the lining of the pelvis. So it is very, very painful. Prevalence is around like 11%, so around 6.5 million women in the US are affected by this, and it is more common among women in their 30s and 40s. Some of the signs or symptoms of endometriosis: painful periods, right? Stomach pain and extreme cramping before period starts, and it lasts for days. And it could be like possible lower back pain and stomach pain are common. Pain with sex, discomfort with like bowel movement or urination, so before or during our period. Heavy periods or spotting in between our cycles. You could feel fatigued, um, fertility issues, anxiety, depression, and some people, they don't even have symptoms, and they find out about having endometriosis when they're trying to maybe get pregnant or have other fertility issues. So some of the cause, there's still like no exact cause of knowing what causes endometriosis, but some possible influencing factors. It could be our genetics. So if you have a female history of like your ancestors have it, you could get it as well. Retrograde menstrual flow. So what that means is when our period blood, like which contains like our endometrial cells, when they flow, it flows back through the fallopian tube and it like into other areas of the body, such as the pelvic area. So like it's supposed to get out through our body, but it just flows back. So that's what retrograde menstrual flow is. And immune system dysfunction is when immune system fails to find and destroy the endometrial tissues growing outside the uterus. So like it just doesn't work. It doesn't detect that there are endometrial tissues growing outside. So it's just like growing uncontrolled without any check and balances in our body. So some hormones could be so endometriosis depends on our hormone estrogen, which can increase like inflammation, growth, and pain associated with the disease. So how do we do the diagnosis and test? They can have like pelvic exams, just checking for cysts or scars behind the uterus, ultrasounds and MRI. So there's no exact cure for endometriosis, but treatments are available. So if you have like mild symptoms, taking over the counter like medications like ibuprofen can help. Hormonal therapies, so you can, if you're not trying to get pregnant, you can try birth controls, or if you are trying to get pregnant, you can try the gonadotropin release hormones agonist, which is like agonists are like artificially increases the hormones in our brain to stimulate ovulation. So it's all about like, when we take this, we ovulate better, so like chances of getting pregnant is better. So surgery is an option to remove endometrial tissues, and fertility treatments like IVF is also available. So how does endometriosis impact on mental and physical health? So chronic pain like can lead to anxiety, depression, frustration, and women may also feel isolated, as this condition can be difficult to diagnose and understand sometimes. So the constant struggle with pain can cause mental exhaustion on someone's body and health. It's like the intense pain and the bleeding and fertility struggles can take a toll on women's everyday life. And like women may experience fatigue and lower quality of life and significant disruption to work and relationships. So next we have is fibroids. Fibroids are basically benign tumors or growths in the uterus, as it's also known as uterine fibroids. So on the right side on the image, you see little fibroids growing in different locations. So they just have different names. The prevalence is around like 26 million women in their reproductive age are affected. It is one of the most common gynecologic conditions. Some signs and symptoms. Many people actually with uterine fibroids, they don't have any symptoms. Those who do have the symptoms can be dependent on like by location of the fibroid, size of the fibroids, or how many fibroids you have. So some of the symptoms could be heavy period, or menstrual bleed, or prolonged menstrual bleeding, pelvic pain or pressure. Someone might go to the bathroom a lot, frequent urination, or have difficulty emptying their bladder. Back pain and leg pain are also very common. Another thing is when they have fibroids growing, you could have like a larger enlarged abdomen. So it could look like you're pregnant, but you actually not pregnant. You just have fibroids. So there's no exact cause, but some factors could be like genetic factors. So genes can change actually. Many fibroids, they contain changes in genes that differ from our typical cells in the uterus. So they just grow. And if you have any family history of it as well, you have a chance. Hormonal imbalances, so with like our estrogen and progesterone playing an effect. And obesity and low vitamin D is also common cause. prevalence is actually disproportionately higher in African American women, African American population in comparison to whites. That's what I did. The research showed me, and some treatments. Some diagnoses and tests, ultrasounds, MRI, and blood tests, and some treatments could be like if symptoms are mild or like just barely there, it's best bet to watch and wait and not do anything. Just make sure you're tracking it. Medication, birth control, GnRH, anti-inflammatory drugs, surgical options. Some options could be myomectomy, which is removing the fibroids, or it could be hysterectomy, which is like removing the entire uterus. And there are some non-surgical options as well, which is like uterine artery embolism or MRI guided focus ultrasound. So how does fibroid impact mental and physical health? So coping with like heavy bleeding, pain, and potential infertility issues can lead to stress, anxiety, and decreased self-esteem. So the unpredictability of fibroid symptoms can create a sense of loss of control. Physical impact could be symptoms like heavy bleeding and pelvic pressure can limit daily activities for one. And the physical impact of fibroids related surgeries can also affect the recovery time, and like also you have like long-term health issues that you can consider as well. Next, we're talking about PMDD, which is Premenstrual Dysphoric Disorder. Before I talk about PMDD, I want to explain what PMS is. PMS is premenstrual syndrome, which is like a mild symptoms before period. So most people experience some sort of period related symptoms a few days before or a week before their period. So PMDD is basically a severe form of PMS. So you have intense emotional and behavior symptoms that are not common in PMS. Prevalence is around 5 to 8%, and which is around 2 to 5.3 million women in the US are being affected by PMDD. And some of the signs and symptoms could be severe mood swings, irritability and anger, and that's just like some of the common ones. And you can have depression, you can have anxiety, fatigue, sleep disturbance, so it could be like sleeping too much or like not sleeping at all. You could have joint or muscle pain, severe bloating, severe headaches, breast tenderness, or changes in appetite, like whether it's like overeating or having specific food cravings. So some of the cause would be like hormonal changes like linked to menstrual cycles, neurotransmitter imbalances. So serotonin plays a role in here. Serotonin is a hormone. Serotonin is a neurotransmitter that regulates mood, and it can be lower in women who have PMDD. So lifestyle changes, lifestyles like poor diet, lack of sleep, stress can lead to PMDD. Another thing to consider is childhood trauma or abuse. I've read a lot of research articles about that. So it's like if a woman goes through childhood trauma or any sort of abuse, it's shown to increase the chance of developing PMDD. Diagnosis and tests, like basically you track your symptoms, right? So you track at least two menstrual cycle, and you log that. Health assessment, so checking for physical and mental health assessment. And treatment options are like lifestyle changes, like change your diet, exercise, sleep better. Medications like anti-inflammatory medications and neutral supplements like B6, calcium, or magnesiums are treatment options. So impact on mental health and physical health of PMDD. So extreme mood swings, when we have that irritability and depression, it can lead to significant mental distress. Women may feel a loss of control, experience isolation and feel overwhelmed by the severity of the symptoms. And they may like decrease interest in activities on day-to-day. Physical symptoms such as fatigue, bloating, and headaches can disrupt daily activities and productivity. It could change in appetites, change in sleep routine. So weight gain is also common. The severity of PMDD can also affect relationships and overall quality of life. So we talked about all 4 of the diseases and what they are. So what is next for us? So we have all this information. What are we to do? So first thing first is to, if you or somebody you know have any of the symptoms, or you would like to talk to somebody, first thing is to consult with the healthcare provider. And you also want to document your symptoms, because sometimes when we go to the doctors, maybe we forget what our symptoms are. So like write them down at least, so that you have better understanding of your symptoms as well, and learn more about the treatment options. So once you know what you have, or if they try to diagnose you with something, just learn more about like how you can help. So rather than the problem, focus on the solution, like how can it get better. And consider seeking a second opinion. Sometimes, if you don't feel comfortable, or if you're not satisfied with your diagnosis or your treatment plans, you can always go to another doctor, get another opinion, and look for support and resources around you. You're not alone going through this, so look for the support system, and maybe we have your county, your state have something to provide. Look through them. Some of the resources I looked up while doing this presentation: American College of Obstetrician and Gynecologist, ACOG, their website have detailed information, as well as NIH. They have detailed information on all the diseases we talked about, whether it's PCOS, PMDD, endometriosis, or fibroids. They have tons and tons of research articles that you can look through to learn better. If you're going through a crisis, you should use the 988 Suicide and Crisis Lifeline. In New Jersey, we also have Mental Health Association in New Jersey. We have an office in Union County, which is in Springfield, and I have the numbers over here, but they're other in other counties as well. So if you need support, you can always reach out to them. And you can always join a support group or community resources, like Facebook groups that are private or public. I actually went back and I looked up some groups that you can go for, people with PCOS, people with PMDD. Facebook has a lot of support groups and communities, as well as Reddit communities, like subreddits like r/PCOS. They offer anonymous support and advice from others experiencing similar issues. So you might be having one symptoms, and other person might be having a different symptom. So it's always good to know what others are feeling out there, so you're not alone and feeling lost and isolated. With that being said, these are my references. I am concluding my presentation. Thank you very much.
Thank you so much, everyone, for joining us for that amazing presentation. And thank you so much, Khadiza. That was very informative. If you enjoyed the presentation and you want to keep up with what NJ4S Union Hub is doing in the community, you can follow us on the social media at NJ4S Union, or if you have any questions about our program, you can email us at NJ4SUnion@preventionlinks.org. Thank you again for joining us, and have a great rest of your day.